It's often said that a hospital is a city within a city. Keeping the healthcare system running smoothly is a complicated task, and there is a huge variety of occupations that need to work together to make sure buildings, systems, and equipment are fit for purpose.
I'm Chloe Wade and I'm a Learning and Development Apprentice at Warwick Hospital. I organise and coordinate work experience placements in the trust, so I work closely with the schools and the colleges to organise rolling placements. I also process all the completed care certificates that the clinical support workers do, and I organise a celebration event for them all to receive their certificates and badges. I work closely with the other team next door, and they deal with like the statutory and mandatory. I left school after GCSEs and I went to sixth form, and I did psychology, business and sociology, with the intention of going to university to study psychology, but I decided that I wasn't too sure on that, so I looked into different apprenticeships and the route that I could take on the business side of things in the health service instead of psychology, and then I saw this one and I applied for it. With work experience, obviously most of the students are all interested in a career in healthcare. Quite a lot of them are interested in going into the clinical side of things like nursing. By allowing students to get an insight into the job before they actually come and work here, we're making sure we're getting the right people for the role, so that patients get the best care. I would definitely say if you were going to go in a career in healthcare to look at other options other than just university. It's not the only way to get into the NHS, you can go down the apprenticeship route.
Hi, I'm Leanne Johnston and I'm the Apprenticeship Coordinator here at South Warwickshire Foundation Trust. On a day-to-day I answer many emails about functional skills, apprenticeships, work experience. I also meet managers within the trust to organise apprenticeships throughout the departments. I also meet apprentices to make sure they're supported well. I find it very rewarding when I see someone starting and being very nervous and not sure of if that's what they want, and then coming out at the end and actually pursuing something they love. Straight from school I decided that I wanted to do fashion at college, but after a year I found out that that wasn't quite right for me. I then went to work as a full-time waitress at a hotel. I then realised that that wasn't quite right for my career either, and decided to start looking for business administration apprenticeships, and then that's where I started my career within the NHS. So when I started at the NHS, I started as a business administration apprenticeship, level 2, and that was in the learning development department, doing data inputting and supporting others within the department. I then secured a full-time role 1 year later within the same department, doing induction process for new starters, and then after around 3 years I got a pay upgrade and also started doing the apprenticeship side of things. My advice to students would be to gain a good pass in maths and English, as this will open the door to further education and the access to apprenticeships. So once the GCSEs are achieved, I would advise all students and young people to go on to find work experience within the NHS, within multiple different departments, so they can find out different aspects of the NHS, and then they can make a more informed decision on what area they'd like to pursue a career in, and then they can decide if they want to go on to an apprenticeship, go to college, university.
Okay, my name's Nicola Watts. I'm the Nurse Recruitment and Flexible Workforce Lead here at UHCW. And within my job role, I'm looking at recruiting and retaining registered nurses, newly qualified, healthcare support workers. The reason I love working here at UHCW is they have some amazing trust values that they uphold. I've also worked within many of the teams here at UHCW, and they're all about working in partnerships and working together, and also ensuring that we're putting our patients first in everything we do. So that's why I love to work here. Within the current role that I do here at UHCW as a recruitment nurse, I believe I have a positive impact on the nurses and the healthcare assistants that we recruit here, supporting them through their assessments and their interviews, which then in turn will have a positive impact that they will then be able to give to the patients that they look after on a day-to-day basis. I also work on the neonatal unit. I work bank shifts on the neonatal unit, so I believe the care that we give to the patients, our premature babies, and the support that we're able to give to their families and their extended families as well, I think is very positive. I firmly believe that anyone can aspire to be what they want to be. It doesn't matter what background you're from or where you've come from. As long as you're willing to work hard and try your best, I'm sure you'll be able to achieve your dream job.
My name's Sophie Heavyside and I'm the Press and Media Officer. I communicate a lot with members of the press, so from radio to TV to newspapers, trying to promote events that Myton are running, lots of fundraising that we do, the vacancies we have for volunteers, because we have over 1,000 of them, so we're always on the lookout for more people to join us. I talk to a variety of staff and volunteers about what they do and how they help Myton to continue, and that keeps our social media and our website content flowing as well. Myton is 37 years old now. It cares for people with terminal and life-limiting illnesses who are over the age of 18, and in the last 12 months we've looked after around 1,800 people and their families. I went to university to study broadcasting and journalism and was absolutely desperate to work in radio. I then did a radio placement fresh out of university and loved it, but also realised that I really enjoyed writing news as well, so started to look for work at a local newspaper. I spent 2 years at a local newspaper series as a reporter and decided that there were parts of the job that I didn't enjoy anymore, but the thing that kept me going was being able to talk to people and promote the good things in the world rather than just reporting on the sad and the bad and the ugly stuff. The job at Myton did just appear randomly. It honestly popped up out of nowhere, and I thought, actually, what a nice sidestep to go from working for a local newspaper to working for a local charity on the other side of things and getting the local news outlets to promote all the good that's going on at Myton. Healthcare is a really great sector to look at working in. It's not all about doctors and nurses and people that have those kind of clinical and medical skills. There is so much that goes on behind the scenes that helps support that work that doesn't necessarily need you to have got a first-class degree in some sort of science or whatever. It's a great opportunity to feel like you're contributing to something bigger than just you.
My name's Chloe and I work as the Executive Receptionist here at UHCW. So at UHW I am the receptionist and for the exec suite, and my roles and responsibilities are the first point of contact for people, so external visitors and just general inquiries, and if any internal visitors come in, then I can assist them. I got into this job by first working as a hostess on the wards and serving tea and coffee and dinners to patients. I then looked on the NHS Jobs website and they had a variety of different roles that were on offer, and I seen an apprenticeship come up and thought I'd apply. So this was an MVQ level 2, was able to learn on the job as well as interact and develop my skills. From gaining my maths and English already through my GCSEs, this then gave me a good foundation and a head start in able to pursue a career within the NHS.
My name's Claire Holden and I'm an Executive Assistant at UHCW. Being an Executive Assistant, you definitely have to start by making a good relationship with the person you're working with, and it ends up being that you manage them more than they manage themselves. You are their diary, you are their contact point, and I don't think that they could run day to day without your organisational skills sitting behind them. I think for this role itself you definitely needed previous PA responsibilities and information from the other roles like this because it is a very intense job. Just being part of the NHS itself, even just looking out of the window to see people coming in and out to appointments all the time, knowing that the work that's done up here is definitely impacting what goes on across the whole trust. Definitely look, it's not all about clinical. You get appointment letters come through from the hospital and you think that's, it just magically appears. People are behind that letter and them appointments, and there's lots of admin roles and other variety of roles at the hospital that you can do.
I'm Karen Martin. I'm the Chief Workforce and Information Officer and Deputy Chief Executive at University Hospitals Coventry and Warwickshire NHS Trust. So my role at the moment, I'm Chief Workforce and Information Officer, and also I'm the Deputy Chief Executive. That is at University Hospitals Coventry and Warwickshire, which is a large acute hospital in the middle of Coventry, and we also cover the Rugby area. We employ about 9,500 staff, and we have a turnover of over 600 million. So part of my role is ensuring that we look after that £600 million in a sensible way and in a way that makes the best use of that money for patient care. What I like about this role is that it's different every single day. There's a whole range of issues. So one day you can be sat all day in meetings, which aren't the best days. But other days you can be talking to patients, talking to relatives. Sometimes we spend time out in a service on a back to the floor, which is really interesting and helps us understand as executive actually what is really happening out on the ward areas rather than just reading it on a piece of paper. It's that variety that keeps me interested. So I've had a long career in the NHS. I grew up without generalising, many little girls thinking I wanted to be a nurse. I got through to interview for a nurse but decided not to go to that interview as I felt that wouldn't be the best thing for me and my skill set. So I ended up going on a training scheme in the NHS, and the first placement that I was on happened to be in HR, which is human resources, and I loved it so much that I took a decision there and then that I wanted my career to be both in the NHS and to be in HR. And from that point I've worked in a range of different organisations and joined this trust 5 years ago in this role. I like to say and like to think, without it sounding twee, that I've made a difference. And I think one of the impacts where my role can make a difference is within workforce, where it is often about recruitment, looking at training staff, that we help get the best staff into the organisation and then keep those staff in terms of training and their qualification and support those staff in being the best that they can be, which in turn helps the patient services. That's the difference. The thing that I would say to anybody considering an apprenticeship in the NHS, the first thing I would say is you can do it. We all think sometimes that we can't do things or other people can do them better or differently, but the variety and the range of help and support you get is second to none in my opinion. As I said earlier, didn't particularly have any aspiration to work in the NHS. I didn't understand it that much, but when I joined the NHS it was absolutely where I wanted to be. The opportunities are second to none, the support from your colleagues are second to none. I've now achieved 38 years in the NHS, many different places in the NHS, but I've never wanted to move away from the NHS, and I've never once got up in the morning thinking I do not want to go to work today. I mean, one of the other things I'd say for those who are looking at an apprenticeship in the NHS is the scope is almost limitless. The variety of roles that we have across the NHS goes well into the hundreds. There is often a perception that it is nurses, doctors or secretaries. It is so much more than that. Therapists, admin assistants, catering managers, psychologists, all manner of posts are there and available. And I would encourage anybody to look at the number of roles that are available, because there will be one that suits everybody's skill set and aspiration.
My name is Jareth now, and I am a PALS and Bereavement Officer. I do two roles, the PALS and the Bereavement, so the Patient Advice and Liaison Service. So I'm here to help patients, if they have any questions about the care that they're receiving or any concerns. I see what we can do to resolve that. On the bereavement side, I liaise with the doctors and the relatives of the bereaved patient, and we just try and make things easier for them. I left school. My first choice was to get an apprenticeship within the NHS. So I originally started on the general management corridor as an executive and membership apprentice. From there, I did my business administration level 2, did that for 18 months, and from there I felt like I wanted more patient contact, so decided to go and work on the receptions. I worked on the receptions for 11 months, and then from there I found my way into the patient experience team as the support officer, where I got touch for PALS, bereavement and formal complaints. And then recently I have just become one of the PALS and bereavement officers. When I left school, I did only leave with 4 GCSEs, so that was originally a big worry, but was able to develop myself within the NHS, and now have done my level 2 and level 3 in business administration, and also have completed my IT functional skills level 2 and 3. Go for it, really. There's no harm in going for it. If you don't enjoy it, you can always see what else there is out there, but definitely it's opened up the door for me. When I left school, I didn't know what I was going to do. I didn't get the results I expected, but the NHS has helped me with that.